I'm personally very proud of this project. I think it really adds both capacity as well as some innovations to how traditionally we run hospitals. My own view is that's something that I learned from the libraries. They have always impressed me, our libraries, because each time they build a new one or renovate or rebuild an old one. So that time Chairman Tan Chin Nam, I think, insisted that every library must be better than the previous one it replaces or it adds to. So we took the same approach. Of course, we don't build as many hospitals as libraries. And all the more, we have to make sure that every project is really a real value add to the whole landscape. So therefore, I had high ambitions for this hospital. So I challenged the team. From a patient's point of view and visitor's point of view, let's make it hassle-free. So hassle-free is just an adjective. It's up to them to define, from the patient's point of view, what is hassle-free. So they did quite a number of focus group discussions. And of course, most of the patients are elderly and may not be as fluent with English or literacy. So that was, I think, their starting point, which I thought was a good starting point. And then the second major point was elderly patients tend to have all kinds of chronic diseases. So typically, they will end up seeing quite a number of specialists, attending different clinics. And if it is not well coordinated, what it means is you have to make many trips. So how do you then, as a background, make sure that the IT system, for example, can support, so that oh, this is the same patient, and he needs so many clinics visits in the next 1 month. Let's just coordinate it. So it's common sense, but then how do you make sure it can be done and executed? And that does require some thinking. And so since the opening, I've been looking at the data every now and then. So for example, midnight census, they have exceeded 200. So what does it mean? What it means is additional more than 200 beds have been added to our capacity. A&E, they are seeing more than 200 attendances a day. Outpatients, they are seeing more than 800 outpatients a day. So this means that the burden on the other hospitals should be eased. And it shows, because Tan Tock Seng, we all know, has been a bit of a crowded hospital. And occasionally, in fact more than occasionally, they have to have diversion, so ambulances being sent to the other hospitals, causing problem in the other hospitals. And that has eased. It has not been completely removed, eliminated yet. Mainly because the ambulances have not been formally coming to this hospital yet, which will come about next Monday, from next Monday onwards. But the fact that it's already easing the situation and it's noticeable. So I'm hopeful that after next week, the situation will improve further. So I think for the moment, the bed crunch problem will be addressed quite almost fully, in a matter of weeks. And then, not yet, because the ambulances are not fully on the. See, ambulances work by catchment, so they have not put themselves on the catchment zone yet. So all the, say my residents in Woodlands, ambulance, it will still go straight to Tan Tock Seng. But the last few days they try it out. So they work very closely with the civil defense. So they just, every day I think they probably take in about 10 ambulances just to test out the system. And so far so good. So I think next week we should be able to see the full impact of that. Yeah.